All right, guys. Hello. So this is Dr. Green. This is a re-recording um, of the lecture from Monday. So the weather was pretty dicey Monday, and I recorded this uh, at a Barnes and Noble in the cities somewhere between the cities and my house, and it didn't save, so we didn't get a chance to post that because it didn't actually come through on via email from Google Meet. So I'm recording it. And sorry that's taken me a little bit longer than planned to get it re-recorded. This week's been kind of hectic with the weather here and everything like that. So, all right, let's go ahead and get started, and we'll get through this lecture. We'll go ahead and go through this recording, and we'll knock it out. All right, so guys, here we go. So this is the cardiovascular system, right? So I know that all of you pretty much probably know a little bit about this, maybe from anatomy and physiology. So this is going to be a review for most of you, right? So obviously, the cardiovascular system, its main job, uh, you know, it includes the heart, right, and blood vessels. But its main job is to deliver nutrients and oxygen to the tissues and remove waste products, right? So arteries deliver oxygen and nutrients to the tissues, and the venous system itself, right, removes those waste products along with the lymphatic system, which we'll talk about later, right, removes waste products from the bloodstream. Um, and so ultimately, when we talk about the role of the kind of the ultimate purpose, right, of the cardiovascular system, it's actually tissue perfusion. So what is tissue perfusion? Tissue perfusion is essentially delivering blood and oxygen, right, like kind of like we've just said, right? So obviously, blood that is deoxygenated, or blood that does not contain oxygen, um, is essentially reoxygenated in the lungs at the alveoli. So that's actually where gas exchange occurs. And as we'll see next week, or Monday rather, when we talk about the respiratory system, there are there are these little tiny sacs called alveoli. Well, around the alveoli, as we actually have a capillary bed, and a capillary bed is actually a confluence of little bitty, uh, small arteries and veins, and this is actually where the blood in capillaries actually is only slightly oxygenated, right, and is mixed, but picks up oxygen. Uh, at the in the alveoli, and then is transported back to, obviously, to the heart for to be put back into circulation for perfusion to the tissues. So when we talk about the heart, the one thing that we have to keep in mind and remember is that we have four chambers, right? We have a left and right atrium at the top. So if we look here, we can see that we have the right atrium here, and then on the other side we have the left atrium. Okay, the atria, which is plural for atrium, right, are the top two chambers of the heart, and this is actually where blood essentially enters, right, the heart via uh, the the not only the obviously the aorta, but also the um, pulmonary trunk, which is the large purple vein that you see, right? That's actually connected. Uh, or kind of looks like it's almost kind of connected to the heart itself, right? And we can see that right underneath the pulmonary trunk, we have the pulmonary valve, right? And then between the atria and the ventricle on the left side, okay, we have the mitral valve, or the bicuspid valve, right? So blood enters the heart via the right atrium, is essentially, then from there goes into the right ventricle, and then, right, is essentially delivered to the lungs, right, via the right ventricle, uh, goes back into essentially pulmonary circulation, and then arrives back in the left atrium, and then into the left ventricle, where it's then essentially ejected out to the body, right, to the tissues. So, and you don't really see this so much in this drawing here, but the vast majority of the time, the left ventricle is actually larger, right, than the right ventricle, simply because the muscular walls are typically a little bit thicker, um, because of the distance that blood has to travel throughout the body, right, due to increased peripheral resistance uh, in the arteries. right? So the left ventricle often is a touch bigger than the right. Now, the other thing that's really important to know uh, when we talk about the heart itself is that there's also a circulatory system that actually feeds the heart muscle itself. Okay, and these are the coronary arteries and veins. So if we look here, we can actually see, right, coming right off of the aorta, we actually have what's called the circumflex artery, right, and then a branch off of that is the left anterior descending artery. So we can see this artery here, and this is actually the artery that is most often blocked in the event of a heart attack, right? So when a coronary artery itself is blocked due to either a clot and or due to maybe some fatty plaque that is dislodged and is lodged in the walls of the artery, that is referred to as a heart attack, right? So when we have essentially a blockage to the coronary artery, that is referred to as a heart attack, right? All right, and we can see obviously again another, uh, kind of here obviously the aortic arch, excuse me, and we have obviously the pulmonary trunk here, superior and inferior vena cava as well. But additionally, right, the heart also has an electrical conduction system. And if we remember from anatomy and physiology, we know that there are two main nodes, right, in the heart. The first one being the SA node. The SA node is our pacemaker, right? It's the one that really starts the heartbeat and kind of gets the heart beating, right? So if you've ever used or seen uh, a an AD used, right? This actually is meant to essentially stop the heart, right, and allow the SA node to essentially reset itself. Okay. Now below that, okay, you can see the AV node, right? Uh, and as the impulse travels from the SA node to the AV node, it then travels through what's called the bundle of His, right? And then down the left and right bundle branches, right? So as the SA node essentially fires, we have depolarization of the heart, right? And then obviously, as the heart repolarizes, as the impulse travels from the AV node down the left and right bundle branches, we have repolarization of the heart and contraction of um, the ventricles, right? And so that process of depolarization and repolarization is essentially where we essentially learn our EKG tracings from, right? Uh, and so that is essentially a graphical representation of the electrical activity of the heart. Okay, so if we continue to look here, one thing that we will also see, right, is that we have obviously this interconnected system right between the arteries and veins, obviously the heart, right, the aorta and the peripheral vasculature being the arteries, right? So ultimately what we can see as well, right, is that we progress obviously from arteries, right, to arterioles, right, down to capillary beds. And as we said previously, we know that those capillary beds contain what we call mixed blood, right? Blood that is really neither fully oxygenated, excuse me, or fully deoxygenated, right? And so that blood obviously then enters into the venous system, uh, goes back to the heart, right, and then is reoxygenated in the lungs. But the bottom line is that the circulatory system as a whole, right, is essentially a closed system, right? Okay, so looking at the peripheral, the vessels themselves, right? What is it that makes up? What's kind of some of the main differences between arteries and veins? We already know, right, that arteries carry blood away from the heart, whereas veins carry blood toward the heart. One of the main anatomical characteristics as well that sets a vein apart from an artery is the fact that a vein has valves. Okay, a vein has valves, whereas an artery does not. Okay, an artery does not. So if you look really closely, right at the artery, the one thing that you're going to notice about the artery is that we have essentially these different layers, right? So we have an endothelium, right, or a tunica interna, right? Uh, and then ultimately we have that lamina, right, or that kind of the space through which the blood passes. Now, one thing to know, okay, about our tunica interna, particularly our capillary beds, is that the junctions between those cells are very loose, right? And so it allows for essentially passive diffusion of blood and also of oxygen molecules, so on and so forth, CO2, between the capillary beds. Now, obviously, we can also see that the artery itself, right, actually has a smooth muscle. So we have the tunica media, which is the middle layer of the artery, right, and then obviously surrounding that we have smooth muscle, right, and then we have the tunica externa, which is fibrous tissue that surrounds the wall of the artery, right, and we can also see that in veins, right, we have essentially a tunica a tunica externa, just like in the arteries. Google's fussing at me here. Sorry. This may be the reason why this didn't record on Monday, but we're gonna push through here. Okay, so we can obviously see that also with our veins, right? We have um, obviously a tunica externa, right? That outer layer of the vein. We have a smooth muscle layer as well, right? Followed by an endothelium. So, not necessarily a middle layer. We have an outer layer, a smooth muscle layer, and then essentially an endothelium, right? But again, the main point being that veins contain valves, whereas arteries do not. Okay, so a little bit more discussion here. Just some quick review of roots and combining valves. So cardio, okay, cardio or corono means heart. Okay, atrio, okay, it's the root of combining valve for atrium. Angio, blood vessel. Okay, aorta, aorta or aorto, right? That means aorta. Okay, valvo, or and we can see even below here, valvulo. Okay, root and combining valve for valve. Okay, ventriculo, ventricle. Phlebo, meaning vein. So if any of you, as a good number of college students do, right, donate plasma to sustain your monthly budget, right? You have had your blood drawn by a phlebotomist, right? Somebody who studies and or is a vein specialist, right? So they do, literally dozens of blood draws per day, and they are very technically skilled when it comes to obviously not only venipuncture and drawing blood, but also doing things like blood gases, starting IVs, those types of things. Okay, so some prefixes, right? So we have endo. Okay, endo, that's inner, the inside layer. So uh, the inner layer of an artery, right? Endothelium, right? That's that inner layer of the artery. If we did, for example, an endarterectomy, we would be making an incision to the inner layer of the artery. Okay, myo, okay, root and combining valve from muscle. Okay, so myocardium, right, is the muscular layer of the heart. Perio, that's the outer layer of the heart, right? So the pericardium, we'll talk about that maybe a little bit more in a minute. But pericardium is the outer fibrous tissue surrounding the heart muscle itself. All right, so a few more obviously roots and combining valves here. We will go over these again in class together on Monday, right? So thrombo, okay, clot. All right. And we'll talk about also the difference between, right, a thrombus and an embolus. Thrombus is essentially a stationary clot that lives on the inner wall of a vessel, right? But the issue and the main danger with a thrombus is that the thrombus itself can actually become dislodged and begin to travel throughout the bloodstream. Uh, Once that happens, okay, we can develop what's called an embolus, right, which is essentially a clot that is moving. Oftentimes, these can lodge in the lungs and or even in the vasculature surrounding, leading to the brain. Can cause things like pulmonary embolism and or stroke, right? So, speaking of blockage, right, ischo, right? Uh, there's a term that we'll learn called ischemia. Okay, that's essentially lack of perfusion, lack of blood flow. So ischo means deficiency or blockage, right? Athero, okay, means fatty plaque. Somebody that has atherosclerosis has a hardening of their fatty plaque. Okay, brady means slow, so a heart rate of less than 60, whereas tachy means fast. So someone who is tachycardic, okay, tachycardic, pertains to a heart rate that is fast or greater than 100 beats a minute, right? So some suffixes for you, right? So we have AC or ac suffix. Okay, means pertaining to. Uh, apheresis, right? That means removal. Okay, crit, separation. Whenever you take a sample of someone's blood, um, and you spin that in a centrifuge, ultimately you will get a portion of that blood that is essentially just packed cells. We refer to that as the hematocrit, or the separation of the blood, right? Hematocrit, right? Graph is recording. So an electrocardiograph, or an ECG, or an EKG, right? It's the German spelling of it. Um, is essentially a recording of the electrical activity of the heart, right? Uh, Odemia is a suffix for pain, right? Penia means few or abnormally low, right? So somebody who is cytopenic has a low number of cells inside of a sample. Okay, we already kind of mentioned that sclerosis means hardening, right? And then stenosis, so often a consequence of hardening of the arteries and heart disease, right, is stenosis, or narrowing of the artery, right? Narrowing of the space of the lumen of the artery, that can often lead to heart disease, and God forbid heart attacks and cardiac arrest. Okay, so a few more terms to be familiar with here, um, and we will go over these together again together on Monday. When we're talking about, for example, coding for cardiac conditions, right? Obviously, these are going to, be found in the letters section I00 through I99. And sometimes there are also additional blood disorders that may be coded for in a clinical situation as well, depending on the situation. Okay. So, guys, that is a kind of a quick, brief overview of this lecture. Once again, sorry for the difficulties on Monday as far as that not recording, but this should come through. And as soon as it does, I will get it on Moodle. Okay. And I'll also email you guys the YouTube link. Okay. Have a great night. And I hope you guys are staying safe and warm. Take care.